Aging begins when you're born. And aging begins when you're able to make certain choices. And I do believe that, of course, I believe paradoxically in absolute determination. You know, there's a kind of a physical determinism that's built into the nature of quantum mechanics, indeterminacy, determinism. And there's a certain kind of, if you know, the French have this phrase, tout comprendre, tout pardonner. If you understand everything, you pardon everything because you realize that everything is inevitable. Or as Sartre said, upon the death, I don't remember of who, but death transforms a life into a destiny. In other words, it couldn't have been otherwise. That's true, but it's also true that we live in a kind of Brechtian world in which we make and are able to make choices and influence the way we move down the streams of life and also can influence life. So it's one of those deep contradictions that we are determined, but we are free. As Milton said, and I have most of my degrees are in English. I have one degree in theater, which was late on, but you know, we are sufficient to stand, but free to fall, which means that we are given enough to be who we are, but we also have the liberty to be who we are not. I'll stop there.
So he'll pause there. So when we first came in, we were speaking with the organizers of the event about the way that this project, the Aging Incubator, started, what that very name means, and you just kind of touched on that. And Joshua said, well, that the charge was to do something about the aging problem, that aging problem. And so I thought about that because, well, it's interesting, of course, would we say the problem of childhood or the problem of youth or the problem of middle age or the problem of aging? And of course, part of the problem of aging is thinking of aging as a problem. Although at the same time, one doesn't want to be too Pollyanna-ish about it because there are some specific things that, you know, I certainly wake up and complain about my lower back and my eyesight and all kinds of other things. And then there are more serious things that we confront, including ideas about mortality and, you know, getting closer to that end of things.
Another concept related to aging, I think, has to do with the word passion. You and I both talked, I think, about how we both feel blessed in a way to pursue what we love. Me, film also, film history, and from an archivist perspective, and you as certainly a historian and significantly also as a creator. And I wonder if you could just talk about this notion of loving what you do and how that can transcend the idea of you're getting older.
Yeah, I think passion should be there for everything that you do, and love certainly translates. Richard Williams, the great animator, said, love certainly is shown on the screen, meaning what you put into your work comes across on the screen. So age has nothing to do with creativity, really. I mean, you mature, you learn things, hopefully, but you know, if you have that basic love, it's going to be there when you're a child, you know, teenager, middle-aged, or an old person. So love what you do, and good things come out of it. I do tell my students that don't worry about where your career is going to go. You only have a very short period between that, you know, blank part before you were born and then the blank part that's coming afterwards. So enjoy what you're doing and try to be kind to people. They should hear
There's the composer, Clint Mansell, there's a song, it's called Death is a Road to Awe. And I do like the song, but more than that, I love the title. Um, and, you know, in a similar vein, there's also Deepak Chopra said once that death is a creative opportunity. And I love that too. And so in the images and the photos, there's a striking perspective on aging and community and death in terms of the deaths that happen in the village and the response and the celebration and the embrace that happens. And so that really, in viewing this, the first time I viewed it at Kimmel, and then time since then really warms my heart. And I appreciate that perspective, and I think it's one that in the West we don't often experience.
Right. Yeah, I'm glad you mentioned that, us in the West, so that in that context, I'd like to hear from the audience how we responded. Here we are, we're all from the West, how we responded to these images, because I think that on some level, in my mind, when I presented this at Kimmel, and even now as I present it here, I think that it is an encounter of two worlds, and how exactly, where exactly is the meeting point between these two worlds?
I think important for us to consider this global aging issue. The global aging issue needs to be solved at the local and family level. The local level, the regional level, the family level, to really understand. As we were hearing, Shanghai has a very different fertility rate than other parts of China. So you always have to go right to the community and see what it is that you can come up with. And when we were looking at our particular issue, this is the city of Philadelphia is, oops, I went too fast. City of Philadelphia is on the, on your left. And then in the pink is the area that we focused on to establish our long-term care community program. And on the right side is a spatial modeling, dot mapping that we used using some original GPS modeling, combining it with city census data and city data on how functional people were, and also who owned the homes in those areas. As we age, we want people to be able to remain at home. That's where everyone wants to live, in their home or neighborhood. And so in this map, we were able to find that in the darkest colors, that these were the people who were the oldest, over age 85, that these were also people who had some functional disability, needing help in getting around, and also owned their homes, so that they wanted to remain in their homes. And this helped us then focus an economic model on how we would deliver this program. So this
Successful Aging. All of you in the gerontology field know about this book. Written by John Rowe and Robert Kahn, who led the MacArthur Foundation study on aging. Now, I am not a gerontologist, but I know a lot of gerontologists. And they all recommended to me to read this book and think about it in terms of master sports. And one of the things that Rowe and Kahn talk about in their definition of successful aging are these three factors: low risk of disease and disease-related disability, high mental and physical function, and active engagement with life. So let's look at master sports in terms of this particular definition of successful aging. I know there are many different definitions, but focus on this one. This is Bob Ward. When I photographed Bob, he was 76. and he looks 46. Okay? Bob is the former strength coach for the Dallas Cowboys. That's why he looks like this. And he told me a very interesting thing. He said that exercise in service of a sport is so much more psychologically reinforcing than just exercise for general fitness. And what he meant by this was that if you are engaged in a sport like track and field, where you can measure how fast you run, how high you jump, how far you throw, when you see yourself increasing, you are more likely to continue that exercise program which led to those improved results.
After the day we arrival, we visited that hospital, and we were told we will work in East Campus of the People's Hospital in Wuhan, which is also a large hospital, around 1,800 beds. They turned the beds, total of 800 beds, into the infectious disease ward for severe COVID patients. And our team is going to take over the 2 wards, totally for 80 beds. And these beds are only for the severe COVID patients. There are already some patients there, but there will be more patients coming. And also, we just start work at the second day of our arrival. And on March the 31st, we finish our job there and turn back over the wards to the People's Hospital. And during these 55 days in Wuhan, we treated more than 150 patients. And more than 110 are severe cases, 30 are critical severe cases, some as moderate. Discharge around 90 patients, transfer into mild case ward, and 6 patients died, and around 20 still in the ward. But also we got to know that more and more patients get discharged. And the second day we finish our job, we depart from Wuhan back to Shanghai. Now I'm staying in the hospital for self-quarantine.
Caregiving has never been easy. And I think and also remember, this is a long-term disease. So people are not facing, getting over a broken hip and rehab in, let's say, a year. We're talking about the long term. And it's daunting. And there is, often in caregiving, there is the feeling that no matter what you do, it's never enough. And caregiving is also very isolating. Families report that other family members, friends have pulled away. They're not comfortable dealing with the person who's now confused or disoriented or not behaving in the same way that they did before. And that isolation is only compounded by the current stay-at-home order, by the confinement that's being mandated. And so family members are being put in a position where either they are caring for their relative and living with them, and there's no relief. It's this unrelenting job. And remember, everybody is feeling the increased anxiety and uncertainty about what it's like to live in a world where there's COVID-19. There's no real forecast about when this is going to end. Only increases one's anxiety. And so there is a real need to help counteract that. And so our programs, which were very often very in person, and our trainings were in person, the education meetings were in person, our support groups, we have 85 support groups, were in person. They've all now transitioned to either telephone or video chat like this. And it's been really successful.
The staff has been amazing at really kind of stepping up and kind of moving into this new normal of how we work, doing these wellness calls and doing Zoom calls and playing bingo with the seniors over the phone and things of that nature. The thing that they're hearing constantly also is that, as both my colleagues, is the seniors are ready to be back. They're like, well, can we just do a half day, or can we just do a couple of hours? And we would love to be able to do that. And the staff, they're very anxious, and they're waiting to hear what's going to happen and when we're going to be called back in, because they are concerned for their own health or the possibilities. We have been called to be a cooling center, so there's additional concern there in terms of making sure that we, open in an appropriate way. How their concern is, with the seniors, the challenge is going to be keeping them socially distanced, because as soon as they have an opportunity for us to be open, even as a cooling center, they're going to want to socialize, and it's going to be a challenge to keep them separated. But it's just a new way of thinking, and really trying to make sure that both the staff and that the seniors also kind of have an understanding that we have to move differently going forward.